Hi everyone, I'm going to show you how to set up a fluid bag and run it through your fluid pump and your fluid warmer. So first what you're going to need is all of your supplies. You're going to need your fluid pump. This is the fluid pump that we use for soft tissue. It is a digital pump and it is separate from the one that we use for Cohatland. So when you're in soft tissue, in order to prepare your fluids, you will need this fluid pump. You will also need your fluid warmer. Both of these appliances should be plugged into the wall. Even though they have batteries, we want to make sure that they are fully charged during our procedure, so we leave them plugged in. You're also going to need a fluid bag. I'm going to be using a 500 ml bag right now. However, we do have different sizes, which can be used for different size patients. You're going to want to grab your LRS solution when we are doing fluids here at Carrington Surgery Lab. You're also going to need a primary set. This is either going to be a macro drip, which has a rate of 15 drops per milliliter, or it's going to be your micro drip set, which has a rate of 60 drops per milliliter. You will need an extension set in order to run your fluids. And lastly, you will need a fluid label and a Sharpie in order to label your fluid bag. We always use Sharpie when we label our fluids. The first thing that you're gonna do is you're gonna write the time. Make sure you include AM and PM on here. You're also gonna write your date and your initials. Now, we are not adding anything to our bag, so we're going to write no additives. Your fluid bag is good for 1 day, so the date we expire is going to be tomorrow at 5:17 p.m. Now you are ready to open up your supplies. These fluid bags tear right down the middle. I'm going to show you guys a macro drip set, so our 15 drops per mil. So we're going to set our micro drip set to the side. You want to keep your bag here because it's going to be useful for inputting your information into your pump. Next, we're going to open our IV extension set. So in order to aseptically prepare a bag, first you are going to pop off one of the openers. Then you are going to release the cap of your spike here. And you are going to feed it into your bag. You want to get it all the way so that there is a nice seal here. We don't want it hanging out. Make sure you clamp your fluid line so that you don't get fluids flowing out while you attach your line to your bag. Now we're going to add our extension set. We're going to remove our cap on our lure lock end and remove our cap to insert the ends together and lure twist it on. Now that you have your line ready to go, we want to add our label to our bag. We're going to be adding our label to the reverse side of the bag where we do not have any writing so that we may access that information if we need it. Next, you're going to need your trash can. And in order to run your fluids through the line, you can hang it on your pump pole. We want to run our fluids into a trash can as to not get LRS everywhere. Make sure that you are handling your line aseptically so you're not removing the cap unnecessarily in case it touches anything. All right, now I'm going to remove my cap and I'm going to set it on the counter right side up so that the top of it isn't touching anything. And I'm going to open my line with the roller. Now we want to bleed our fluids through and make sure we have no bubbles in the line. I'm going to squeeze a little bit extra fluid into the chamber here so that we are at this line marker. So I just squeeze fluids in until it gets all the way up to the line. This ensures that we have enough fluid in our chamber and we do not get any air in our line. All right, almost there. Now you can see I'm at my safe level of fluids in the chamber. Next, what I do is I look at my line to make sure I do not have any bubbles. All right, we have a couple at the end, so I'm just going to run it through again. And I just saw them pass out. Now I'm going to recap my fluid line. Next, we are going to turn on our pump. The button for the power does not have a regular symbol. It does not have like a power on. It's going to be these small circles here. We want to clear our last treatment because we are not going to be using those rates anymore. All right, so we're going to enter our rate here. We're going to say that our patient is receiving 50 mils per hour, and we're going to confirm. Now we want to have a volume to be infused. This is going to be our 3-hour rate. So we are going to enter 150 because that is 50 times 3. You can see we're setting it for a 3-hour rate. We want our volume infused to be 0. We want to start with 0. If you didn't clear your last treatment, you might see a number here, in which case you would need to clear it so that you're starting at 0. Now what I'm going to do is I'm going to run my line through the pump. This is counterintuitive. You do not want to push. You want to pull down here on the bottom. And then we're going to leave our clamp above our fluid pump so that we have easy access to it. You don't want it down here because you want to be able to have easy access. First, we're going to feed it through the safety by quietly lifting this up. And we feed it into the safety and we pop that back down. You can see which way to feed your line because there is an arrow, a unidirectional arrow. Now you are going to close your pump. All right, now we need to select the brand. This is where your primary set is going to come into play. So right now we are calling this an ICU medical brand. We need to change that to be Zoetis Series A. So we are going to select a different brand and we're going to go over to Zoetis A Series. This is how your pump knows if it is a macro or a micro set. All right, we have our pump all set. We can throw away our garbage now that we do not need it. And now the last step we need to do is run our line through the fluid warmer. The fluid warmer has a little clasp on the side that you're just going to pull down and open up. The end of the fluids should be coming out of this side here. They're going to feed into the middle. And I want you to leave a minimal amount of hosing line out of the fluid pump. I don't want you to feed out of the fluid warmer. I don't want you to feed the line so far down because then by the time the liquid gets out into the line, it isn't warm anymore. So we'll leave about this much left. We're gonna run it through. I always like to run it through the middle part because that's gonna be the warmest. And we feed it out. Close this on up. And we have it run through our fluid warmer. Now the last thing you wanna do before you're all done is to unclamp your line. Now we can safely ensure that our fluids will flow through our pump at the selected rate through our warmer into our patient's IV catheter. Thank you.